The host sits in a room with white walls, in front of wooden shelves and at a desk with a laptop.
Hello, and welcome to Module 3 of the Indian Child Welfare Act, or ICWA, Active Efforts Learning Series. This module covers the role of collaborative partners in the implementation of active efforts to support American Indian and Alaskan Native families, known as AIAN families, affected by substance use. To facilitate this learning experience, we have gathered questions from state child welfare supervisors and workers specific to the content of this module. Let's start with a question about the need for cross-system collaboration.
A new host stands in a room with books, files, and pictures behind him.
Is child welfare the only agency responsible for active efforts?
While the State Child Welfare Agency remains responsible for the implementation of active efforts, the foundation of an effective system of care for AIAN families affected by substance use is a strong cross-system collaborative team. Its members establish trust by effectively following through and being responsive to the strengths, culture, and needs of the family, while drawing on the talents, expertise, and resources of many organizations and people with lived experience who are in recovery and have prior child welfare involvement.
A picture of a woman blowing a bubble for a child.
Agencies typically involved in these collaborative teams include child welfare services, substance use disorder or SUD, and mental health treatment agencies, courts, public health and healthcare providers, early childhood, community-based agencies, recovery communities, and tribes. While these agencies should comprise the collaborative team, it's essential that the family's tribe guide the team on matters regarding culturally specific services and supports. A holistic, culturally responsive approach requires multiple agencies working together to provide coordinated, streamlined services for AIAN children, parents, and family members.
I understand that it takes multiple systems coming together to improve outcomes for AIAN families. What are some concrete actions that partner agencies can take to ensure active efforts happen for AIAN families affected by substance use during pregnancy?
There are several ways system partners can support the implementation of active efforts. Here are a few you can share with healthcare and other service providers as you collectively serve AIAN families during the prenatal period.
A graphic with blue circles representing each active effort.
Identify pregnant AIAN individuals. Screen for substance use in a manner grounded in building sacred trust, and offer a prenatal family wellness plan to provide culturally specific supports and services. Help pregnant AIAN individuals affected by substance use find and access prenatal care with a healthcare provider knowledgeable and experienced in these specific areas. Help pregnant AIAN individuals find SUD treatment that matches their level of need via a validated screening tool. Develop a birth plan with the family that honors their tribal customs and decision-making autonomy. Your system partners can also support AIAN families by implementing efforts to reduce stigma related to substance use disorders, or SUDs. Pregnant and parenting people who use substances face tremendous judgment when seeking medical care.
A picture of a woman helping a girl with building blocks.
These biases, especially from healthcare workers, family, and friends, isolate individuals and make it harder for them to seek prenatal care or substance use treatment. They might fear for their safety, or the safety of their children, or even their pregnancy, which makes it vital for healthcare and substance use treatment professionals to support AIAN families in a non-judgmental and welcoming way. Healthcare and substance use treatment providers also play key roles in ensuring pregnant patients who have an SUD receive whole person care. This can include easing concerns pregnant patients may have about their safety, as well as other health, financial, or housing needs. Pregnant patients with an SUD also need special considerations related to labor and delivery, peripartum pain relief, and the treatment of co-occurring mental health disorders.
Are there specific ways partner agencies can reduce trauma for AIAN families affected by substance use?
Your partner agencies play a critical role in reducing trauma for AIAN families. First, they can ensure active efforts remain trauma-informed while providing a sense of safety as well as opportunities for choice. When someone experiences a trauma, the first two things stripped away are their sense of safety and choice. Our actions should carry these two trauma-informed principles at all times. It's important that all staff working with AIAN people during the perinatal period recognize the prevalence and effects of individual and intergenerational trauma. Some Native people, for many reasons, experience higher levels of daily trauma. Thus, it's helpful to reflect in peer groups, supervision, or reflective practice on the challenges AIAN families face.
A picture of a girl hugging another child.
One example is balancing positive emotions linked to pregnancy and birth with the negative memories of previous traumatic events. AIAN individuals may present a range of behaviors as they manage these conflicting emotions. They may or may not wish to share with their partner, family, or those involved in their care. Staff working with perinatal women can support all individuals, whether they choose to disclose or not, by showing compassion and acknowledging that a history of trauma, including intergenerational trauma specific to AIAN communities, may affect a person's experience of pregnancy, birth, and parenthood.
Families may already have trusted healthcare or other community providers that could support them after the baby is born. Does collaboration typically work well?
Yes, here are some ways partner agencies can support the implementation of active efforts during the neonatal, infancy, and postpartum periods.
A graphic with blue circles representing active effort supports.
Explore whether underlying trauma, including individual and intergenerational trauma, is a factor in a parent's substance use or misuse, and coordinate trauma services, including cultural healing practices concurrent with substance use treatment services. Help parents locate inpatient treatment programs where placement of child and parent together is an option. If unavailable, help parent access inpatient treatment close to the child so visitation can occur consistently. Ask about and support the family's practice of tribal or traditional birthing and parenting customs. Learn how your profession can preserve connections between AIAN families and their community. Healthcare providers play a significant role as partners supporting AIAN families engaged in active efforts during the postpartum period. Here are 5 trauma-informed practices they can implement.
Numbered examples of active efforts on a blue background.
Keep families together as much as possible during their hospital stay by using methods such as combined parent-baby care via rooming in and promoting early, frequent skin-to-skin for bonding and other parent-baby neuropsychological benefits. Consider the relationship between trauma and breast or chest feeding. The physical contact of breast or chest feeding can be uncomfortable for some trauma survivors. However, there are several strategies that might help. Include a focus on parent-child relationships in all interventions. Clients with a history of abuse or trauma may have more difficulty attaching to their child. However, with the right culturally specific services, they can heal as both individual and family. Assess for perinatal mood and anxiety disorders for AIAN women and childbearing people with a history of trauma, since they are more likely to develop postpartum depression. Ensure the family's birthing plan and postpartum support team invite and include extended family. Thanks, everyone. And remember, cross-system collaboration remains critical when implementing these efforts, and there are multiple points of intervention where these partners can engage in the process. While we discussed some examples, National Center on Substance Abuse and Child Welfare has a wealth of resources to further expand your knowledge base on families affected by substance use. You can visit ncsacw.acf.hhs.gov for more information. Also, visit the Capacity Building Center for Tribes at tribalinformationexchange.org for more resources aimed at nurturing the safety, permanency, and well-being of American Indian and Alaska Native children, youth, and families.
The ACF, Children's Bureau and SAMHSA logos.